The thing is, no, we've got a whole bunch of volunteers, so it's going pretty fast.
Who's here? Who's here? Anybody?
14 right here.
But we haven't seen her.
No, no, no.
Okay, so put her back over there. 2007, I decided that we needed to do something for animals who weren't able to get vet care. And so I got together with Chris Matchin and Natalie Azaza, and we went to the homeless shelter for people, and they gave us a room in the back, and we started vetting animals. And one of our purposes is to educate clients. A lot of our clientele have never had the opportunity of even talking with a veterinarian, so giving advice. I call it paying forward because we are doing a community service that didn't exist. Would you be able to make sure someone can get up here so we don't stop it? Because, you know, we don't want the kitty to have this problem when it's real simple that we can prevent it, right?
Yes, ma'am.
Okay, good.
I live in Gainesville and I work at a laundromat. And I have 3 cats. Had 4. One just passed away in August. And I financially can't afford taking all 4 to the vet like I used to, or all 3. And St. Francis really helps me out. And Dr. Kaplan really helped me with save my monkey's life last, 2 months ago.
Okay, and good luck,
you,
and we're just gonna have to hope. I know, and I hope it works.
So I do appreciate it, and it's a really good program. And this is Baby here. And I've got 2 of her little, how you doing? I got 2 of her baby boys, Monkey and Vicious.
It's been I'm a retired nurse, and so I'm also an animal crazy person like everybody else in here. And so I thought it would be terrific if we could do all these things and help take care of these animals, keep them with their owner. But I was also very interested in the owners. I think from my point of view, not only is what we do, it's a health. I think we have a healthier community because these animals are spay neutered and vaccinated, and now I don't know how many we've done. It's beyond anything I could comprehend.
Oh, these things?
I got to Gainesville a little over a year ago. I was homeless, landed in this area and found out about the pet clinic. It was pretty healthy, so I wasn't participating. And then had a very serious scare and got him in here. These people got him in here on an emergency and got him fixed up. And here we are a year later. They're still helping me take care of my 15-year-old dog and giving us a few more days together.
So that's.
I think that there is probably a lot of pushback from private practitioners that feel that maybe this kind of a clinic is going to take away their business. But I also believe that people that utilize a clinic like this, especially if you do really good screening, these people are not going to go to private practitioners. They can't afford it. They don't have the money. And so I think that a clinic like this teaches students also how to be kind of practical veterinarians, and maybe not doing everything gold standard like you learn in vet school, but still being able to diagnose a disease or treat a disease, relieve animal suffering, but not spend as much money. And I think that's the value of this clinic for our students.
My name's Sugar.
Sugar? Come here, Sugar. A lot of them don't have a reason to trust anybody, and they've had a hard time for a long time. And so one of the things we really wanted to do was to make sure we were here every single Tuesday. And, you know, here comes the nice ladies, and they're gone in 5 weeks. It happens all the time. So we really wanted to make sure that they could trust that they could come and we would be here. And I think in almost 7 years, we've missed twice. Neither one we had anything to do with. It was a construction thing, that kind of thing. And I mean, we have some of our clients that come, they don't need anything for their animal, but they come just to see who's here.
Keeping animals with people who deserve to have their pets, even if they are poor, is very important for our society. And this should be something that hopefully we can move across Florida and move across the country and develop a program. I'm not talking about doing rocket science and major surgeries. I'm talking about just the nuts and bolts of healthcare. And we have proven here at St. Francis Pet Care Clinic that it works. So we have a model to work with, and we want to spread it throughout our country.